Good morning and welcome everyone. Thank you for joining us today. My name is Hannah Wood and I'm the Marketing Manager at the Kentucky Chamber of Commerce. We are excited to host a webinar with ClearPath Mutual on loss prevention and claims management during COVID-19. ClearPath Mutual has partnered with the Kentucky Chamber of Commerce to offer all of its members and its participating affiliate chambers a 10% association discount on their policies. I want to give a big thank you to our participating local chambers and chamber members for joining us today. Before we get started, I want to remind you of our chat box function. During the presentation, feel free to leave any questions for our panelists in the chat box, and we will pull a couple of those at the end for a short Q&A session. Another reminder, this webinar will be recorded and sent out afterwards. It will also be available on our website at kychamber.com/clearpath. Without further ado, I will turn it over to our presenters today. First, we have Kevin Fallahay, Vice President of Claims at ClearPath Mutual. Kevin recently celebrated 24 years with ClearPath last month and has 36 years of workers' compensation experience. Also joining us is Mike Klyer, Loss Prevention Manager at ClearPath. He has been with the company since 2004 and manages loss prevention initiatives and safety resources, including training, education, and awareness material, which are all resources are free to policyholders. So with that, I will turn it over to Mike and Kevin, and thank you so much for joining us.
Thanks, Hannah, and thanks a lot for the lot of appreciation to the Chamber for helping us with this webinar, and I thank everybody for joining us. I hope it's helpful. We will have some questions at the end, and I'll give you some contact information if you had some questions after we finish all this. You know, in the new day of COVID-19, people working at home, things have been referred to as the new normal. I prefer to call that the next normal. And the challenge facing companies and employees is adopting to the next normal and the next normal and the next normal after that. Workers' compensation coverage, loss prevention, and claims management remains essentially the same. Claims management, though, begins with loss prevention.
That's right, Kevin. And again, I'd like to extend my appreciation for this opportunity to share these thoughts. We appreciate the Chamber's help in this as well. One of the things I like to say is, as my job is to make Kevin's job easier. The more we prevent accidents, the more time Kevin has for the golf course. So I think it's very important, and we take our role very, very seriously in preventing accidents, not just for Kevin, but for those employees who work around the state. This is why I think loss prevention is important. The next normal is understanding that employers have the same responsibility for employee safety at home as they do at work. Integrating new safety initiatives is important, and implementing new claims initiatives are essential.
Yeah, that's correct, Mike. Thanks for that. He is correct. The best way to lower claims cost is to lower the number of your claims. Just remember, when the claims department gets involved in a claim, something's already happened. We become like a Band-Aid, and our job is just to mitigate. But once the claim has been filed, someone's been hurt, there's usually some cost assigned to it. So Mike's job is to make sure you never have to deal with me. Obviously, COVID-19 claims are now part of the workers' compensation system and will be for a long, long time. It is important to understand how companies should manage these claims.
Yeah, Kevin, one thing to keep in mind, OSHA cannot be ignored even when employees are working from home. An OSHA advisory concludes that companies who let employees work at home are responsible for health and safety violations at the home. Now, I would not expect a knock on the door from OSHA anytime soon to inspect the house, but it is an issue that is on the radar for OSHA in terms of exposures and risks that employees working from home are going to be exposed to. So OSHA will not enter homes with their checklist to conduct compliance inspections. However, I would recommend that company managers and supervisors keep the OSHA website close at hand. There is an email notification that you can get from OSHA that will keep you up to date. And this is good information to have, especially in this next norm. Things are going to be changing from OSHA as well. At ClearPath Mutual, our loss prevention consultants are very experienced with OSHA and workers' comp initiatives as they relate to on-the-job safety. Consultants have more than 35 years of experience in the environmental safety and health field. We offer free OSHA 10-hour training for the general industry. We've been doing that for a while. We will return to that in a post-COVID world, but we are looking at doing those on a webinar. However, the 10-hour course requires 2 days of mandatory attendance. So a 2-day webinar, we need to work on that a little bit. One of the things that OSHA does encourage is for companies to do regular inspections, to look for risks, to look for exposures that are in the workplace. Companies should also encourage employees working from home to conduct inspections as well. Now, there is a good checklist for home safety is available at telework.gov.
Thanks, Mike. And as we talk about reporting claims in the new COVID-19 world, just remember the obligation to an employer has not changed. No matter what type of injury is reported or is alleged to be happening, an employer has 3 days to report that injury to their workers' compensation carrier. So those things, that obligation has not changed. But in this new world, this next normal, more and more people are working from home. And when that happens, the employer loses a little bit of control that you would normally have over your employees if they are at their workplace. So I think the employer and the employee must be aware of things that must happen if there is an injury. And a good checklist that I've come up with starts off with exact time of injury. When did that injury happen? Not it happened in the morning, it happened yesterday, it happened at 8:15 on Monday morning. Also, the precise function that was being performed at the time of the incident. For example, I was going to my printer and I tripped over an extension cord. Something that would show exactly what happened so that we can relate the injury to a work function. Also, was anyone else involved? Were you talking to someone on the phone? Were you accepting a delivery of supplies? So anyone that can help substantiate the injury, that would be very helpful. And number one is report immediately. Do not delay. Just remember that most of the denied claims in our office are due to late reporting. Someone comes in a week, 2 weeks, 3 weeks later and says, oh, I got hurt a while back. So just impress on your employees that you like to have this checklist, and it helps the employer, but it also helps the employee to avoid delays and possible denials of claims. All employees need to follow this, whether they're at home or whether they're in the workplace. But I think now when they're at home, they're away from you, you don't have the eyeballs on them, it's more and more important that they know they have responsibility if they get hurt at home. Now going to the COVID-19 claims, again, the same reporting obligation applies. If someone reports they have a COVID-19 claim, you have 3 days to get it to the insurance carrier. But I wanted to just differentiate between exposure versus a positive test. An exposure, for anybody, if there's an exact exposure and you can relate it to something at the workplace, if someone was exposed to someone else with COVID-19, that's going to be a covered claim. And they could go through the quarantine, the testing. However, I think most of you know the governor issued an executive order several months ago outlining certain types of businesses where there's a presumption that if there's a exposure, if a doctor is going to quarantine someone for a possible exposure, if they work in the medical field, a doctor's office, a hospital, maybe a nursing home, or if they're a first responder, or they work for someone who's providing essential services like a pharmacy or a drugstore or a grocery store. If a doctor says someone has to quarantine because of a possible exposure and they work in that field, they are going to be presumed to have that exposure at work. So therefore, even though you might not be able to relate someone in that field to someone at your place of employment, it still would be a covered claim. And if they have a positive test, same thing happens. If someone outside that medical field, nursing home, hospital, anything like that, if they test positive, they come back with a positive test, those people, again, are presumed, if they work in that field, they are presumed to have contracted COVID-19 at work if it's a covered claim. If they work outside of that, they have to point to an exact exposure for it to be covered. And another thing that's different in the COVID-19 world is the waiting period. In workers' compensation, you normally have an 8-day waiting period before someone gets workers' compensation. If they miss 8 days, they get paid 1 day. If they miss up to 14 days, they get paid for days 8 through 14. If they miss day 15, they get paid from day 1. These are called temporary total disability benefits. However, in the COVID-19 world, waiting periods are waived. If someone on an accepted claim misses 1, 2, 3 days, he or she are going to get paid for those exact days. Again, in the medical field, first responders, any positive test is going to be presumed work-related. Outside of those fields, you're going to have to show an exact exposure at work. Again, any doctor that says someone has to quarantine someone for a possible exposure, if that's in that medical field, that other field, it's going to be covered. If it's in the outside of that, it's going to have to be an exact exposure. That's a pretty good checklist to go by. However, there are also other considerations such as OSHA requirements.
That's right, Kevin. It's important for companies who are required to maintain an OSHA 300 log that they're also required to report any COVID-19 illness. So again, those companies who are responsible for maintaining an OSHA 300 log, you must report COVID-19 illnesses as well. Here's another good reason to stay on top of the OSHA website and keeping that close at hand. One of the things in the next norm for loss prevention is going to be tele-loss prevention. We hear telehealthcare all the time. Tele-loss prevention consultant is going to be more common in the next norm. Now, this might even include inspections via phone. While in-person inspections will be limited, the technology does exist for video inspections. Maybe you've noticed the Mercedes-Benz commercial where the salesperson is on the phone with the couple and they're walking around the car, showing the car, they're actually kicking the tires, gets in the back seat, acts like one of the kids. This is a new, or next norm, I should say, and it would be not at all unusual for us to be looking at inspections in much the same way. So I would anticipate video inspections will become more common.
The same thing has happened in the claims world. We used to go out to companies that we insured and we'd go over claims, status reports, what are reserves. Right now, we're not doing that in person, but we do it telephonically through a Zoom, through a Ring Central. We also, from time to time, have had physicians come out and examine job requirements and look at those exactly what the employee was doing. That helps the physician from saying a condition is related to the injury, to the work, or is not. Those things also can be done by phone, video. So look for those. Once the pandemic has passed, in-person file reviews and doctor visits will be available.
And as I've said, talking to Kevin's good. We've got good people here to talk with Kevin, but if you want to avoid those people, the best practices for reducing and minimizing claims is training, education, and awareness. This is critical in the pre and post-COVID world. We are experiencing now the importance of awareness. And by that, what I mean is every night on TV, all throughout the day, we're getting updates about COVID-19 issues, whether they're the number of claims, if you will, or the number of deaths that we've had. All of these increase awareness to this issue. So it is critical, if we want to continue to work safely, that awareness to safety, be that COVID-19 or slips and falls, is important. ClearPath Mutual created and developed a safety brand to increase awareness for policyholders and their employees. The name of that brand is called Safety Works. The message is you have to work at safety. Remember the message on the COVID-19? We are all in this together. It's important. This is all part of awareness. We like to say we are marketing safety more than we're mandating safety. but it's important to keep awareness high. And this is how we help our policyholders and their employees do that. Keep that message out there. Work at safety every day. The Safety Works program includes free online training courses, free education material like toolbox talks. We call these Safety Works briefings. And we also offer Safety Works merchandise like posters and decals. Unique to the Safety Works program is our focus on developing safe work habits, both on and off the job. Now, a habit, we're seeing habits now being formed with putting our mask on. Every day we get out of the car, we go anywhere, we're getting in the habit of putting a mask on. Well, that takes a little bit of time to develop. Think about how we develop the habit of putting on the seatbelt. Every day we get in the car, we have a habit, and now it's an unconscious habit of putting on the seatbelt. No matter how much of a hurry we're in, no matter how mad we might be or frustrated, that seatbelt gets buckled. Well, that's a habit. It's an unconscious habit, if you will. Unique to the Safety Works program is focusing on this. So the material is based on new research outlined in a book called Third Generation Safety by Christian Silvestri. In the post-COVID world, off-job safety is essential. The best way to keep employees working safely on and off the job is by developing safe work habits. We have produced new training courses, education material, and awareness merchandise to help employees develop safe work habits outlined in this book. Now, I'll be more than happy to send you a free copy of this book to the first 20 people who send an email and request this book. So send your request to Mike Clyer, that's M. Clyer, K-L-E-I-E-R. Best way to remember that is Old MacDonald had a farm, E-I-E-R. That's mclyer@clearpathmutual.com. I think you'll find this book interesting and practical. We've also produced some new communicable disease safety courses that complies with the state guidelines for training and educating employees on the spread of COVID-19. The key to any safety initiative is keeping awareness high. Frequency is the key to on-the-job safety. Frequency is the key to off-the-job safety. Frequency is the key to keep employees safe and claims down.
Thanks a lot, Mike. In summary, from the claim standpoint, what I'd like to tell you is we are in a new area, so different situations are arising every day. Our staff is 14 claims professionals with an average experience of 20 plus years. We've already processed over 500 COVID-19 claims. So if you have any questions, any problems at all, please feel free to contact us. But just remember to impress on your employees the things I talked about. They have a claim, the exact time, what were they doing, anybody else involved, and report the claim immediately. On the COVID-19 claims, just remember about the fields, certain fields that are automatically, if they're sent home because of a possible exposure or a positive test, if they're in that type of medical field, first responder, essential services, those people are going to be covered. Anybody else outside of that type of business, what you're going to need to show is an exact exposure at work. But again, things are coming up every day. I have 30 plus years experience. I'm getting a new question every day. Questions will not bother us. Give us a call, or you can email me at kfallahay@clearpathmutual.com. But I can't impress on you enough. Please call us if you have any reporting or claims handling questions. Questions never bother us.
Thanks, Kevin. In summary, also, from a loss prevention perspective, in the post-COVID world, safety off the job is as critical as safety on the job. When working from home, don't forget the T, TEA, training, education, and awareness. You have to consider that now that employers are not close to you. So find a way to communicate to them. Find a way to raise awareness and keep that frequency of awareness high. Give employees that work at home the home inspection checklist from telework.gov. Or you can get a copy at clearpathmutual.com in the Safety Work section under inspection forms. I'd like to take this opportunity to thank everybody for joining us. Thank the Chamber for allowing us to participate in this. And I do believe we have some questions. So with further ado, Hannah, do you have any questions? Shoot them.
Yes, absolutely. We have one. It says, for a home health service, we have a company policy of if an employee has been to a COVID-19 hotspot for vacation or family-related issue, that employee cannot return to work for 5 days, then has to have a negative COVID test. Is that covered as workers' comp?
That's a great question, Hannah. That comes up all the time. No, if there's not a known exposure and they're not being taken off by a physician for a possible exposure, it would not be covered. However, if that employee would come back and their doctor says you need to be quarantined because of a possible exposure, that would be covered. So the thing to remember there, if they need to be quarantined for a possible exposure, it's a physician, a doctor that has to order the quarantine.
Okay, great. I believe you did answer this one, but maybe just touch on it again. How many workers' comp actual COVID-19 claims has ClearPath adjusted, an average cost / value?
That's a really good question. We just hit 500. Knock on wood, we have not had very many serious ones. We've had about 3 hospitalizations. So they kind of skew it because the average claim itself is costing us less than $500. But we've had claims that the hospitalizations, the lost times, they're going up. So the average claim right now with those in there are going around $35,000 to $37,000.
Great, thank you. One more. Do names have to be left off of the OSHA log for a positive COVID case like you would a stick because of privacy?
Yes.
Right, and then could you provide the website for the checklist of the OSHA home?
Telework, www.telework.gov, excuse me. That website actually has a lot of good information. It's really set up for government employees, but there's a lot of a wealth of good information on there. And just search checklist. Now, I'm not sure also if they may have been talking about the home checklist in case of a claim. Did they distinguish between that?
Just for the checklist for the OSHA home, it just says.
Yeah, telework.gov is a good place to go for that. Or we have it at ClearPath Mutual under Safety Works, under the inspection form page. There's a lot of other inspection forms that we have there. You'll find that among them.
All righty, well, I believe that completes the Q&A. I appreciate everyone joining us today again, and big thanks to Kevin and Mike and Brad as well. So if you have any questions, feel free to reach out to me or visit our website at kychamber.com/clearpath for any questions. And again, thank you so much.
Hannah, thanks a lot. I thank everybody for participating. Again, you have my email. If any other questions come up, or if I didn't answer them correctly or specifically enough, please email me. And again, situations are arising all the time that we're in a new era. We're in the next normal. But again, thank the Chamber and thank all participants.
Thank you, Kevin. Thank you, Mike. Have a great one.
You guys have a great day.